Hi, good evening. Steve Adler. Got a minute? All right, we're going to look at the numbers tonight. We're going to take a look at the UT model tonight because the numbers are looking like they're headed up. We anticipated this happening, a couple weeks out from Thanksgiving, that there might be a spike. It looks like we might be seeing one. I hope it doesn't sustain. But we'll talk through those numbers. We'll also take a look at projection on what it's going to look like as we enter into the Christmas holiday just between Christmas and New Year's. So we can talk about that as well. But let's begin with the numbers because that's really what we're going to be talking about tonight. Let's go to the first dashboard. And you can see that the number of new hospitalizations has gone to 47. Hang on just a second. We'll pull up that dashboard. Or maybe not. Tell you what, this is what the dashboard looks like. You can see, we haven't done it this way probably in several months, but it still works. Number of new cases is at 47. That's an increase over what we've been seeing. The 7-day running average is now at 37. Yesterday it was at 35. That's because 7 days ago, a number that was 29 dropped off. When you talk about a 7-day running average, it was replaced by this number 47. That gets us up to 7-day moving average of 37. The last several days, we've had numbers in the mid 40s. If that happens to us again tomorrow, it will also displace another number that was in the high 20s. And we could go up by another couple. If that happens tomorrow the same way, we could be up at 39. As that number increases. As you remember, we go from orange to red about the time that we perhaps go up to 50 in this number. That takes us from stage 4 orange to stage 5 red. Hopefully we can avoid that. But remember, the kinds of numbers we're seeing right now, the 47, isn't related to the behaviors that we've been doing the last week when we're urging people to really focus. The numbers we're seeing now, a week or two ago, really the Thanksgiving numbers. This is the number that would be going up if we had a lot of people that gathered with families and friends, not wearing masks, larger groups. We really have to focus on this as a community. But that's what's happening with that number. Number of new cases in the city, not hospitalizations. This number right here, 256. The 7-day moving average was 294. So that the total number of new cases has gone down, but the 7-day moving average were below that. But the concern is over here. But let's talk about these numbers here. This is the 7-day moving average on hospitalizations, ICUs, and the ventilators. And let's take a look at the next dashboard. And I don't know if we've just lost Janine. I hope that you're able to see this as it's working, but let's keep going. This is the next dashboard. You can see that the number of people actually in our hospitals is 265. The 7-day running average was 235. So we're significantly above the 7-day moving average right here. Number of people in our ICUs, and that's our stress point, is 81. 7-day moving average is 78. Total we have available in ICU space is about 200. That's all we can really staff. So we really want to prevent a doubling from happening there. But in order to do that, we have to act and react 2 weeks before we would expect their number to start going down. If we change our behaviors, it's going to take 2 weeks before we see a change in numbers. That's what happened in New York. The numbers got really high. Everybody started being really good, and the numbers kept going up. People wondered why the numbers kept going up when they were being really good, and the reason for that, it's a 2-week lag. Total number of new cases in the city, 41,000. Of significance, we're at 499. In terms of the people that have passed away. That's an increase of 3 people from where we were yesterday. and puts us dangerously close to having 500 people in our community pass away. That's a lot of people. Three more people. As families are grieving tonight. We're still in a much better position than other cities around the state, but you can see what Texas is dealing with right now, and we're going to need to focus. I don't know if we have the ability. I guess we've kind of lost Janine here with the connection, but there's the UT model that I want to talk about. We can't pull it up, but you can get it online. The UT model is looking at hospitalizations, looking at that number in the upper 40s that we have tonight, the 7-day moving average at 37, and now predicts that the most likely scenario, the mean of all the different options that are available, the mean has us going past 50 on December 27th, December 28th, which means sometime between Christmas and New Year's Eve. We're going to have to talk through, and we'll be over the coming days and weeks, what happens if we get to a number that's above 50. We need to pull back so that we can be able to address it early before our ICUs are overrun, especially if that model proves to be true. It's been a pretty good guide in the past. It will change as our numbers change. So if we were able to only keep this Thanksgiving spike to a few days and then it starts coming down, the model number will change. But if it does not change, we're going to have to start talking about doing things like other cities have done, things like a curfew. El Paso had one. San Antonio has moved to a curfew to help slow the spread there. They're looking at an increase greater than ours. Don't know exactly what that would look like. It's under discussion right now. Might start 9, 10 o'clock at night. It's aimed primarily at keeping people from doing social events, gathering with people outside their home unit. Because again, that's where we're seeing most of these increases. It's people that are getting together with friends and family, not the ones they live with, and not wearing masks and not social distancing, because after all, they're with their friends and their family. But that's where the virus seems to be spreading right now. Holiday season is upon us, coming up here real quick. Austin Public Health in its media briefing today said that what we're seeing now is the result of Thanksgiving. We have to plan. If we're rising numbers, we have to do better over the actual Christmas holiday. Again, telling people the most important thing you can do is wear a mask and social distance, avoid large groups, try to stay with your family unit as best you can. Holidays are the place where it's more likely that we're inside with large groups of people inside. And that's why we're real concerned about the holidays. Take a look at that color-coded chart. It recommends to you the behaviors that you need to follow. We have a city council meeting tomorrow, and at the end of the city council meeting, we won't have Got a Minute. We'll come back Got a Minute on Friday. But at the end of the city council meeting tomorrow, I will go on Instagram Live about 15 minutes after the city council meeting's over so that I can talk about that meeting. At the work session yesterday, I talked about the need for us to move forward in the spring with cadet class for officers, and to recognize that those cadet classes can really serve as the change agents, cultural change agents, to really help us with what we're doing to make Austin a safe city, an even safer city. So we're hopefully going to be moving forward with those kinds of plans. I saw that the DPS today was sent to help the police in Houston, which is how that's supposed to work when they get invited in and can lend that kind of support. You all take care. I'll see you Friday on Got a Minute. and Instagram at the end of council meeting. Y'all take care. Be safe.